So welcome back to Paramedic Zach episode 2, where we'll be reviewing flashcards 11 through 20, first giving you 5 seconds to answer each question yourself, and then reviewing each question in depth in a part 2. My name is Zach, and this is Paramedic Zach. Alright, welcome, and let's jump straight in. So this will be question 11. When administering amiodarone to an adult with wide complex tachycardia, what is your dose and how is it given? Alright guys, so the answer here is going to be 150 milligrams over 10 minutes in 100 mLs of D5W or 5% dextrose in water. Now the answer here doesn't have to include D5W. You can deliver this medication with normal saline, but the textbook answer is in 100 mLs of D5W. Question 12. What do you suspect? You have a female patient, 29 years old, with unilateral low abdominal pain that has worsened over the past couple of days and presents with rebound tenderness and either Cullen sign or Gray-Turner sign. Alright guys, so the direction that this card is trying to get you to look in is towards an ectopic pregnancy. Question 13. During cardiac arrest, if you don't have amiodarone, you should use blank at a dose of blank to blank milligrams per kilogram for your first dose and blank to blank milligrams per kilogram for your second dose. So if you don't have amiodarone during a cardiac arrest, you can substitute in lidocaine. The first dose would be 1 to 1.5 milligrams per kilogram, and your second dose between epinephrine doses would be 0.5 to 0.75 milligrams per kilogram. All right, question 14. As intracranial pressure increases, the blood vessels will become occluded. As a matter of self-preservation, the brain will order a blank in blank. In response, the carotid sinuses will order a blank in blank. Alright guys, so I know that with these kinds of questions, the answer could seem like anything, but I made this question intentionally so that I could remember a piece of information that I thought might be vital. The answer here is going to be an increase in blood pressure and a decrease in heart rate. As intracranial pressure increases, the blood vessels will become occluded. As a matter of self-preservation, the brain will order an increase in blood pressure, and in response, the carotid sinuses will order a decrease in heart rate. Question 15. What is your pediatric cardiac arrest amiodarone dose? So if you have a pediatric patient that is in cardiac arrest, you're going to give amiodarone at a dose of 5 milligrams per kilogram to a maximum of 3 doses in between your epinephrine doses. Question 16. What is the adult dose for a calcium chloride bolus? Alright guys, so your calcium chloride dose for an adult patient is going to be 2 to 4 milligrams per kilogram, but oftentimes you'll see that just the entire gram is given. Alright, question 17. An endotracheal tube medication dose should be blank times more than that of an IV dose. Okay, so the AHA, or the American Heart Association, states that an endotracheal tube medication dose should be anywhere between 2 to 2.5 times greater than an IV dose. Alright, question 18. An RR prime in lead V1 is most indicative of blank. Alright guys, so when you have a QRS complex that is presenting with an R prime that is two defined R waves in lead V1, then that's going to be most indicative of a right bundle branch block. I also included on here that in order to qualify as a bundle branch block, the QRS needs to be greater than 120 milliseconds or 0.12 seconds. Question 19. Stable, regular, narrow rhythm tachycardias should first be treated with blank blank, then blank at blank milligrams for the first dose and blank milligrams for the second dose. You're going to treat your SVT patients with first a vagal maneuver, but if that doesn't work, then you can give adenosine at a dose of 6 milligrams, and if that doesn't work, you can give a repeat dose of 12 milligrams. Each time that you give adenosine, it needs to be delivered fast with a normal saline flush. The reason being is that adenosine has an incredibly short half-life. Alright, question 20. When treating a confirmed STEMI, deliver heparin at a dose of blank units per kilogram to a maximum of 4,000 units. So you're going to treat your STEMI patients with heparin at a dose of 70 units per kilogram. So that concludes the rapid fire portion of this episode. In part 2, we'll review each question in depth. If you enjoyed this video, a like would be super helpful to my channel. And if you'd like to get these videos regularly to help you pass your exam, make sure you hit the subscribe button. Thank you for joining, and I'll see you in part 2.